I think there's a lot of opportunity for all stakeholders in this world of biosimilars as they come onto the market. There's a lot of uncertainty around utilization of biosimilars, and it takes an organization and individuals with a longer vision. And we will see the benefit of biosimilars to the healthcare system, but you have to have a long-term look at it. So I think there's a lot of, like I said, some opportunities to be brave. At this point, it is the brave ones who are making those changes, but it is paying off for those. I hope people are preparing because we will see a much stronger biosimilar market when these contracts expire and so forth, and the patent litigations are resolved. And I think that's when we'll really see things open up much more. We're always going to be behind Europe at this point, but there's such an opportunity to realize the value that biosimilars have potentially in the U.S. market. There's just no incentive to do so. This is coming to the question of interchangeability, which is only a thing in the United States. We're the only country where that is a separate designation. In Europe, it's assumed that a biosimilar is interchangeable because it's by definition of biosimilar is highly similar with no clinically meaningful differences. And if we think back to the nature of a biologic product to begin with, there's inherent variation and variability in those products that is just part of who they are. So you can think of it as a biologic. So any biologic, innovator, biosimilar, each dose you're taking is not exactly the same as the dose you took before. Each batch is not exactly the same as the batch you had before. So in a way, all biologics are biosimilars of themselves. And so I think to have to force this interchangeability designation, that all that means is that a pharmacist can switch a product without informing the physician. That's all it means. So it's not a superior designation. That's all it is. It just costs a lot more money to do. It's so hard to predict what's going to happen because it's a very volatile situation with what's going on in terms of biosimilars and policy. I think there have been some improvements. When Scott Gottlieb was commissioner of FDA, he was very pro-biosimilar and is still quite vocal about that. FDA came out with the Biosimilars Action Plan last summer that at least put a stake in the ground of their stance on biosimilar. I think fundamentally people are supportive of the idea of allowing this market competition because ultimately that's what we're waiting for. I mean that's the whole notion behind generic drugs, same philosophical issue or promise around biologics and biosimilar drugs, and so I think hopefully we'll get there. But it's hard to tell where the FDA is going to land because there's so many evolving parts.